Uh, this afternoon, I'm going to discuss with you our new developed dental filling material, Dopamer, which is a novel bioactive dental filling material with remineralization power. Today, there are more than 2.4 or even more than 2.4 billion people around the world that they have some form of dental decay, dental cavities, just in their permanent teeth. If we add children, even more than that. And if not treated, the consequences are going to be pain, discomfort, infection, and ultimately tooth loss, edentalism, which is going to adversely affect the quality of life of our patients. Furthermore, there is a high prevalence, more than 40 or up to even 60% of the time that our dentists, they do a dental filling for you, we have a form of secondary caries or recurrent caries or recurrent decay around this filling dental material, which causes, again, problems for our patients. In order to address that problem and that shortcoming in dental industry, we have developed this new dental filling material. We call it Dopamer, which is a novel bioactive dental filling material, which has the remineralization power. It has antibacterial, anti-caries properties. It is very easy to work with. It has superior mechanical properties. It's a fast-set cement, and it has a list of advantages in comparison to the other materials available in the market. I myself, I am a board-certified prosthodontist, a specialist in dentistry that we work on full mouth reconstruction cases. My background is in, I got a master's in dental biomaterials, and my PhD was in craniofacial biology. I direct a laboratory of biomaterials innovation and tissue engineering, White Lab at UCLA School of Dentistry. Our other team member is Dr. Mahdi Hassani. He's a bioengineer. He got his PhD from Georgia Tech in bioengineering. He did part of his PhD in my lab, and after that he stayed with us for his postdoc, and currently he's a project scientist in my lab and in Dr. Samri's lab in biomedical engineering, and his expertise in biomaterials fabrications and tissue engineering as well. Now, how many of you have any kind of dental fillings in their teeth? Great. Many. So what I want to do is quickly here, just share with you the dental death cycle. All of us, we start with dental caries in our mouth. You go to your dentist, and the dentist will tell you, you have a dental decay, and you have to do a filling, right? So you go there, and the dentist is going to do a it's very loud.
Matthew, help him with that bone.
Can we turn it down?
Yeah, sure.
Yeah.
So loud.
The mic in the meantime.
Okay.
It's okay.
Very
consistent music. I'm sorry for this. So basically, you go to a dentist is going to do a drill and filling for you. In your checkup appointment, 6 months, a year after that, dentist will tell you, you know what, there's a dental decay around that filling that we did for you, and you're basically the reason that we have that because you didn't brush and floss perfectly, so then they're going to do a bigger filling for you. In the next follow-up appointment, in the next checkup appointment, you're going to go back and the dentist will tell you that there might be a need for your root canal, so we have to do a root canal for you because the tooth is sensitive. Then in order to have a nice, a filling for you, we have to do a post inside your root canal. We have to place a crown, and after we place the crown is not immune to recurrent decay because there's no remineralization power for the cements that we use for crowns. So then again, you have problems. You have dental decay, recurrent dental decay that causes more and more problems. And ultimately, the dentist will tell you, you know what? The tooth is hopeless. We have to extract it, and it needs to be replaced with a dental implant. Actually, dental implant. That's the cycle of tooth death that we are dealing with in everyday dental practice. And that's exactly why I'm here today. The current materials that are being used in everyday dental practice are either amalgam fillings or resin composites. While they have significant advantages and good properties, They have the main problem, for example, for amalgam, because they are based on silver and they have mercury, they are cytotoxic. We know that mercury toxicity. They're not in, the color is not fashionable. We cannot use it for our front teeth, and there is a high risk of recurrent decay because there is no remodeling power. The same thing for our resin composites. They are tooth colored, so they are aesthetically nice. However, they have bisphenol A. There is biocompatibility issues with them. Working with them is very sensitive. You have to have special instruments and special material. And because they have polymerization shrinkage, there's a high chance of recurrent decay. And because the reason for that is there is no remodeling power. So after a while, you see those beautiful restorations. We have all decay, recurrent decay around them. In order to address that problem, we have developed this Dohamer filling material that it's a novel bioactive dental filling material which has a list of very interesting and unique properties. Starting with the remodeling power, they are tooth colored, biocompatible, they are very easy to work with, it has antibacterial and anti-caries properties, and basically there's no pre-treatment required. You can just place it in your patient's mouth and there's going to be like a bond between the tooth structure and this filling material. Just a little bit about the scientific background and technology. Our Dopamer is based on like a powder liquid and a powder and a liquid. The powder is based on fluoroaluminosilicate glasses, which is like surface modified with polydopamine technology, and the liquid is based on polyoxalic acid. So when the dentist is mixing this powder and liquid, we're going to get a cement, a hard material, which is our Dopamer, which is based on the polydopamine part and the mer part from our basically copolymer. Either we can mix them in a powder liquid system, or we can put them in basically a capsule with pre-weighed powder and liquid, so the dentist can just activate the capsule, put it in an auto mix machine, and then we can inject it in our patient's mouth. So we have the technology right now. In my lab, we are able to basically fabricate around 50 grams of this material in the daily process. However, we would like to be able to basically go for more like higher and more scale up for industrial basically scale, especially the fact that the amount of the filling material that we need for any kind of filling is like around 0.2 grams. And when we compare the cost that we have for comparable dental filling materials in the market in comparison to our Dopamer material, it is a very promising and very exciting technology to go ahead and continue with. When you're talking about dental material in the dental material world, there are two properties that are very important for us dentists and for the patients. First, the mechanical properties, and second, handling properties. We have utilized Fuji 9, which is one of the gold standard, one of the most popular materials available in the market for dentistry, and we have compared the mechanical properties, and also we have compared the working and setting time for handling properties. So our data here, you can appreciate that it shows completely that in terms of mechanical properties, for example, for flexural strength or shear bond strength, we are significantly improving these mechanical properties. At the same time, in terms of working properties, handling properties, our cement, because of the presence of different basically chemical groups in the dopamine, our cement is a fast sit. So the amount of the time that the patient is going to be in the dental chair is going to be minimized for our patients. After that, we utilized our Dopamer filling material for filling enamel and filling for dentin, and again we compare it with like the Fuji 9, the commercially available product competition, and what we showed is a significant amount of hydroxyapatite formation, mineralization at the surface of enamel whenever we have our Dopamer filling material, and whenever we do it at the interface of dentin, you can clearly appreciate here that we have a rich calcium phosphate layer, the actually mineralization layer between the dentin and Dopamer. When you compare this with what we have for our Fuji 9, our commercially available product, you see a gap. Gap, micro leakage, recurrent decay, versus our material is making a beautiful calcium phosphate layer, remineralization, so we don't have any recurrent decay problem. We did another set of studies. We actually utilized dentine that they have a little bit of decay there. When the dentine or your tooth structure has decay, it has lower mechanical properties. So what we did is we filled that decayed part with our dopamine technology. We immerse the material in the artificial saliva, and after different time intervals, we look at the nano-hardness, the mechanical properties of that interface to see if our material is really remineralizing the interface. There should be an increase in the mechanical properties. As you can see here, from day 1 to day 30, whenever we have dopamine basically adjacent to the caries dentine, there's a significant amount of increase in the mechanical properties. Versus for our commercially available product, we don't see that, and we see that still there is a gap. So basically, these results were very promising for us. So what we did next is we used our poor animals as like experimental model, and we did like a small feeding in the teeth of rat, and we made a small exposure here. So the pulp was exposed, and we used basically 2 different concentration and 2 different formulation of dopamine feeding material, and you can here completely appreciate that whenever we have dopamine feeding material, it induces dental pulp stem cells inside the nerve of the tooth to regenerate dentin. So basically, they can act as a material for pulp capping, so we don't have to do a lot of root canals for our patients, versus we don't see that in our Fuji 9 or commercially available counterpart. Now, market potential, restorative dental materials is a big market. 2016 was around 4.6 billion, and is expected that it's going to go up for 2022 around 7.2 billion. And if you look at the different materials available in the market as a part of this 4.7 billion market, you see that definitely none of these materials available in the market is having the kind of the properties that we are proposing for our dopamine technology. The patent application have been filed. We are going through a full patent application track 1, and we are actually, the response is due, and we are hoping that we're going to get the patent very soon. The very first publication is under preparation, and we are hoping that based on the very good results that we have got, we are publishing in a top-tier journal. We are in contact with our consultant for regulatory pathway, and they have confirmed that we can go for a 510K submission, a PMA application for our basic dental feeding material because of the resemblance and the fact that it's already this, like this kind of feeding material is already being used for different patients in everyday clinical practice. However, what I want to tell you is just not the dental feeding material. There are many other potential applications, starting for dental sensitivity treatment. Whenever we put this material there, because of the mineralization, it seals dentinal tubules with hydroxyapatite particles, so it's going to act as an over-the-counter dental sensitivity treatment. It can be used for early caries prevention. You see these small white spots. You see it in maybe your own teeth, your child's teeth, the children's teeth. That's the start of dental caries, so we can prevent that. And most interestingly, we can have this dopamine technology for like a new kind of toothpaste. And we have been able to successfully incorporate it in a toothpaste, and we have shown whenever we use this toothpaste, the amount of mineralization on the surface of the teeth significantly increases in comparison to commercially available products. So because of this large potential, we are very, very excited. It looks very promising. Look at the competitors that we have in the market. These are like actually the key players, the main dental feeding materials available in the market. But the properties that we are offering, if you see, we are actually standing alone there. We are offering both mineralization power, we are offering antibacterial properties, and also our material is releasing fluoride. So we are actually very well placed in comparison to the other competitors available in the market. We have definitely some risks that there are. These risks are technical risk or like market risk, but we have been able to overcome some of them, and we are working very closely with the regulatory pathway consultants to make sure that we are choosing the right pathway. So far, what we have done, we have been able to engineer the initial formulation of this the dental filling material. We have been able to test the mechanical properties, optimize initially the mechanical properties and other handling properties. We have done the in vivo test in a small animal model, as I showed you, and we think that we are ready to go for the next step. So what we want from our innovation, UCLA Innovation Fund, basically is to provide us funding to be able to optimize the physical properties, the mechanical properties, and handling properties to not even, like, we already like superior, but we want to even do it better. We want to do some long-term fatigue testing to make sure that we can expect how the mechanical is, how the material is going to work in our patient's mouth. We want to like go for scaling up, and we go to the next level. At the same time, we are in touch and we want to go for the pre-FDA meeting. As I told you, we are hoping for PMA application and 510K basically submission. And at the same time, this is not the right basically version. So on our very last milestone, we don't need to do, this is the beauty of the dental filling material, there's no large animal study required. We are actually in contact with our appropriate divisions at the School of Dentistry, and we are going to do actually the clinical trials in the School of Dentistry because we have enough patient population, and we are going to utilize our orthodontic basically clinic to go for clinical trials for our Dopamer technology. And so we have to just fix that, sorry for that mistake. And by that, I just want to thank you for your kind attention.